I did a podcast a while ago on the aging nose, specifically about injectable rhinoplasty, specifically how a little bit of filler in the nose can make someone look younger. The reason for that is that if you think about a witch's nose, the classic definition or visual definition of an older woman is there's a hook, a hump, and then there's a long tip and it's dependent or hanging. You think about that, and that defines aging. I had a patient I just did I just saw her in post-operative for a rhinoplasty, and I said, "Has anyone noticed that you had anything done?" And she said, "People think she just looks younger," and she's an early 40-year-old African-American female. And I said, "You know why that is?" I said, "Because when I raise the bridge, narrow the tip, the nose just looks younger. It's a younger looking nose versus a larger tip and a flatter bridge. So there's this balance where the nose just makes the face look more rejuvenated." So for women that come in and do fillers in their 50s and 60s, want a little bit of rejuvenation, I just do a little bit of fillers into the nose, and it makes such a huge difference. What's interesting is if you've got a hump, you've got either a poor rhinoplasty in the past or whatever it may be, and you're undergoing a facelift, I may talk to you about a rhinoplasty as well, because what's really interesting is if I do the nose, it can actually take another 10 years off your face, because when the nose looks more youthful, then the face looks more youthful. And you also think of another example, Leonardo da Vinci, the famous artist, drew younger men and older men. And the older men, if you look at those drawings, they have a hook nose, they've got a hanging tip, and they've got a hump. And those are just signs of aging. The reason the nose ages is the fact that the tip starts to lose its structural support, and over time it starts to collapse downward. This area called the scroll, which is a connection between the upper and lower lateral cartilages, in other words, between the middle and the lower third of the nose, starts to separate out, and the nose tip starts to drop. So it actually doesn't get bigger, it just lengthens. And so that lengthening effect is what's happening. Now, what's interesting with my rhinoplasty technique, I've talked about this before, is I use what's called a Caudal septal extension graft. And that Caudal septal extension graft is just a graft that anchors the tip in a very secure fashion, which should be stronger than the day you're born. So it almost resists against aging. So in 20 years from now, the nose should really not dip. Whereas if you didn't have the rhinoplasty, it probably will dip, especially if you're a fair-skinned individual and especially if you're a male.